Good morning, everybody. It's 11 o'clock, and we have a full agenda, so we should start. And people will continue to join while we are started. So, welcome first to the first webinar series of Public Safety Communication Europe. We are very pleased to have a wide audience. We received more than 130 registrations. Participants are coming from more than 18 countries, all over Europe, also outside of Europe. So my name is Marie-Christine Bonamour. I am the Secretary General of Public Safety Communication Europe. I will start with the introduction, and then we will have our three speakers. The purpose of this webinar is to present the European framework and guidance on some possible solutions on the development of social tracing app with our three speakers. There is not a single day without any news, article, or debate. But what is it exactly? Contact tracing, also named social tracing app, are used to identify the persons that have been in contact with the person infected by COVID-19 and inform them about appropriate steps. That could be testing or quarantine. Contact tracing apps are considered by authorities as a possible tool to limit the spread of the virus, as well as to help the phasing out of the confinement measures. Many elements have to be in place to guarantee trustful and accountable use of this tool. Before starting this insight into some solution, we are limited in time and we cannot present everything. I would like to remind you of some rules of order. So you will receive afterwards the video on the presentation of today. You are all muted for this session. There will be for question and answer after each presentation. So please write your questions under the chat. So you will see on your WebEx screen, if it is not yet activated, I think it's the fifth button that could open the chat section. And because we are limited in time, we will pick up 1 or 2 questions per speaker. I want you also to turn off your camera because sometimes when all cameras are on, the quality of the audio and of the session could be diminished. So let's start now, but we have also to manage uncertainty in this difficult time. I just received a message from Mr. Herbel. He will be a bit late, so he'll join us in a few minutes. So we will start with our second speaker, Martina Karl from the Technical University of Munich, and she will present the aspect related to under decentralized digital contact tracing service. And then we will come back to Peter Herbel when he will join. He's always in meeting, and it's difficult for him to be available, but thankfully he will join us later.
Hi, can everybody hear me? Okay, I will now share my presentation with you. Okay. Now I will present digital contact tracing systems with a focus on decentralized digital contact tracing, and also how we can improve current designs and preserve privacy and security even better. We'll also have a short comparison with the centralized system so that we have it clear what the difference between the different approaches are. Now, as a general concept, we want to use Bluetooth because it offers several advantages. For example, we measure only real encounters. It also works in subways or in buildings where, for example, GPS would not work anymore. We don't track absolute positions. We only track vicinity between devices or between people, and it has a relatively low power consumption compared to GPS or Wi-Fi, for example. Now, the concept that I'm presenting now is the decentralized one, and it works like this. We have a phone. Now we start here on the left side. Each phone creates keys, and these keys are then used to generate tracing contact numbers. These tracing contact numbers vary in time, so they are updated, so you don't have the same tracing contact number for several days or an hour, but it changes, for example, every 10 minutes so that you can't be tracked that easily. You exchange this tracing contact number with other people via Bluetooth, and everybody else, and also you store the received tracing contact number together with the time interval and the signal strength. So you have a measure for contact period and also for how close the other person has been to you. Now,
yeah, sorry to interrupt. Are you in full screen mode?
Yes.
Okay.
Can you see everything?
We can see everything. So it's not exactly on full screen mode here, but that's okay. Okay, you can go on. That's not.
Okay, no, but then let me try something else. So then I will just share my screen. And then I hope that this is... Can you now see the full screen?
Perfect.
Okay, wonderful. So in case of infection, so we have all exchanged our tracing contact numbers, and if now I find out that I'm tested positive, I can upload all the keys that I used for generating the tracing contact numbers to a central cloud. Now this cloud can regenerate the tracing contact numbers that I have used for exchanging and makes this tracing contact numbers available for everybody. Every other user can then query this cloud and download these tracing contact numbers. And locally on their phone, this is why we call it a decentralized approach, locally on their phone, they can check for a match. So nobody else knows whether there has been contact or not. And if there has been a contact, the user gets a notification. Now this has one weak spot, which is this part here, because everybody can see what the tracing contact numbers of the infected users are. They could attempt some linkage attack. A linkage attack is an attack where an attacker tries to link something like the tracing contact number to the actual identity of a person. So this could look, for example, you take a camera, you take a phone, you install it somewhere in the city, you record the people who are walking by, you also record the tracing contact number of these people, and then you can, if you see on the cloud who was infected, then check if you have seen this person, and if yes, you check on the camera who has been this person. So this would be an example for this linkage attack. This is, of course, something that we don't want. We want to protect the identity of infected people. Now, how can we do this? We have a short interlude now where we present a private set intersection cardinality, which is a technique what we can use and that we want to use to protect the identities of infected people as well. The idea is you have a set of tracing contact numbers on the server, and you have a set of tracing contact number that the user has seen. Now, the user never sees the entries on the server, and the server never sees the entries of the user. The only information that we get is how many entries are overlapping. So how many entries do we have in the user set and in the server set? And this number of entries in the intersection, only the user gets to know. The server does not know how many people I have seen that were infected. So like this, the user has no direct access on the tracing contact numbers that are stored on the server, and the server still doesn't know how many people I have seen or who I have seen. With this private set intersection cardinality, we can then adjust our protocol here. We need to change something on how the server works. And then our phone checks for the number of overlapping entries in our database and on the cloud database. And if we find an overlap, and also depending on how many and how far we have been exposed, we get a notification. And with this notification, we can then contact a doctor. So here we have a further protection against linkage attack and also for protection of the identity of the infected user. Now, what is really important in our concept here is that the user owns the data at all times. There is no automatic upload. You always have to agree, and everything that you upload is your own data. You don't upload somebody else's data. And if you have a contact found, as also you yourself get the notification. Nobody else gets that, so nobody else can take any decisions for you. The user is responsible for their own data and for their own decisions. And then the user can go to a doctor, and the doctor can then decide whether the user needs to be tested or not. Now, for comparison, the centralized approach. It works a bit differently. We also start with, on the left here, we install the app. And with app installation, the cloud generates a permanent ID for each installation. This ID does not change, and it's registered to each installation or registration of an app. The cloud, the central cloud, then generates ephemeral Bluetooth IDs that are based on this permanent ID and sends these ephemeral Bluetooth IDs to the user. So the ID generation is not on the user's phone, but on the cloud. Now, the users takes this ephemeral Bluetooth IDs and exchange these with other users of the app. And the other users and also the first user store the received ephemeral Bluetooth IDs on their phone. So they have this list with their contacts, or how they call it, the proximity history. Now, if a user is infected, they send the received ephemeral Bluetooth IDs to the cloud. So here I send everybody who I have seen to the cloud, and in this decentralized approach, I send only my own information to the cloud. Now the cloud here knows which ephemeral Bluetooth IDs belong to which permanent ID, because there's this process here in the middle, and it can assign an exposure state to each permanent ID. So they add up the exposures, and if your exposure exceeds a certain limit, then your exposure state switches basically to 1. And then each user queries the server with what is my exposure state. And if this exposure state is 1, you get a notification that you have been exposed. Now, here are also some weak points. Basically, the main issue in the centralized approach is that you have this direct link to the user's phone and to each registration. So there is, you can really trace back which ID belongs to which user. This is the same here. You change these IDs, which can on the server and which are on the server, then directly traced back to you. Also, if you upload all the IDs that you have seen, you basically upload your social graph. You tell them who you have met, you tell them for how long you have met them, you tell them how close you have been. And a social graph is very sensitive information. You can learn a lot about a person, about the social status, if they belong to a minority or anything else, basically, from the social graph. The social graph is also unique for each person, so it's very easy to take a social graph and link it back to the actual person. Also here with this notification, you can also perform a linkage attack similar than what we did in the decentralized approach. You can again take a camera, you can take a device, you can register an app, for example, every 10 minutes. And when you get when you query the exposure state, you can see for which app registration you get the exposure state equals 1, and then you can basically check on your camera which person is probably the infected person. So you can do a similar attack in this scenario. Now to sum things up, centralized versus decentralized, just a short overview. We have questions of who knows what, and then we look at what does the centralized system know and what does the decentralized system know. Now, for example, I want to know who knows who I saw, who I met. In the centralized system, of course, I know that, my contacts know that because I've met them. And if I or my contacts were infected, then also the server knows that because I upload my contacts or my contacts upload their contacts. In a decentralized system, only I know who I saw and only my contacts know that I saw them. Same thing with who saw me. In the centralized system, I and my contacts know that, and if somebody is infected, then also the server knows that. In the decentralized system, all the information remains on the phone, so nobody knows who saw who. Next point is, where have I been? This is a very interesting point because no approach collects any location data of any sort. But if anybody attempts this linkage attacks, for example, you install devices in the city, and if you have been infected and there's this exposure notification, then they could trace in theory back where an affected person has been in the city. Also, especially in the centralized part, I don't necessarily need to know your absolute location to infer where you have been. If I know that you saw a doctor and maybe a doctor's assistant, then I know basically that you've visited this doctor. If I know that you saw a professor and other students, I know you've been at university. So actually there's a lot of information that can be gained with metadata. So here a lot of information is on the server, and again there's this linkage attack that can be done. Now in the decentralized system, only I know where I've been, contacts that I've met know maybe that I've met them. And if infected, there is this linkage attack, but we can protect against this with this point source, with the private set intersection cardinality, and which makes this attack, it's not impossible, but it's very hard. So we can make it really, really hard to do this attack. Have I been exposed? So who knows if I might be in danger to get sick? In the centralized system, okay, I know that because I get this notification, and of course the server knows that. In the decentralized system, only I know that because this match happens on my phone directly. Now, who has been infected is maybe also interesting to know. Centralized system, obviously the server knows because they have this list with this permanent IDs with their exposure status. In a decentralized approach, same as in the centralized, you need this attack. And with this attack, you can maybe find out who's been infected. Again, we can protect against this with private set intersection cardinality. Now, also how many people have been infected. The server obviously knows that because all this information is on the server. And then again, centralized and decentralized, if you manage this linkage attack, you can infer how many people do you see in general, how many have been infected, and then maybe get their percentage here. Takeaway is the attacks that are possible on the decentralized system are also possible on the centralized system. Our aim is to make this as hard as possible. It's probably never going to be really impossible, but if it's very expensive and very difficult, then it's not practical to do them. Other point is the server in the centralized system knows everything. So if anyone gets access to the server or has access to the server and wants to abuse the data that is stored there, they can do so because everything is on the server. So this is a very, very sensitive issue here. Now, another part that is very important, because we also have groups that do modeling of how the virus can spread in the society depending on different means. And what we have found out is that it's sometimes, or many times, it's not enough to trace the direct contacts. You also often need to trace the contacts of the contact person. So for example, Alice here has been infected with the virus at day 0. After roughly 2.5 or 3 days, she becomes infectious. This is the red bar here, and she spreads the infection to Bob. Now, Bob also has the virus, and Bob, after 2 days, infects Charlie. Now, Charlie is also infected. Alice develops symptoms after Bob has spread the infection to Charlie, so at day 6, for example. Now Alice can get a test, and as soon as Alice gets a test result, she can send this notification to Bob. Now Bob knows, oh, I've been exposed, and can also put himself into quarantine, but also Charlie has been infected already, so Charlie also needs a notification that Charlie needs to go into quarantine as well, so Charlie cannot spread the infection here. So it's very dangerous if contact tracing stops here, because then we cannot stop the infection chain completely. So we also need a possibility to do this second order tracing of first order and second order contacts. Also important is we need rapid tests, so that Bob, for example, can test himself and maybe get this result within an hour at home, so that knowing whether Bob has been infected or not, Bob can send a notification to Charlie, well, or not. Another point is that about 50% of people are asymptomatic, so they don't show any symptoms, but they can still spread the disease. So for example, here we have Sean, Kim, and Lisa. Sean is infected at day 0. becomes infectious at day 3 and can spread the infection to Kim. But Sean never shows any symptoms, and Sean continues to spread the infection or to spread the virus, for example, also to Lisa. Kim and Lisa never meet. Kim and Lisa are both contacts of Jean. Now, Kim at some point develops symptoms, for example, at day 10. Now, if Kim gets tested positive, Kim can send a notification to Sean. And if we do second order tracing, then Sean can also send a notification to Lisa. Lisa is only a contact of Sean, would otherwise not be traced if we only do first order tracing. So we can also trace this asymptomatic sources and the people they have spread the infection to, which is quite important because, as I mentioned, we have roughly 50% of people who are asymptomatic. So this is something that we really need in order to stop the spread of the pandemic. To summarize, there is a prototype. It does not include all the features and all the functionalities yet, but people can try it out. There you can find it on this webpage, and it basically right now you see how many people are also using the app and how close they are and how long you've been in contact with, but you don't, for example, you don't see who has been infected or not. We also don't want that because we don't want to have public shaming or anything like that. To summarize, we focus now on decentralized contact tracing with Bluetooth. We introduced some improved designs with private set intersection cardinality and also with second order tracing, which can help to contain infection chains even more efficient and better. And what we're currently working on is the accuracy of distance measurements, which is what we're basically now figuring out. Thank you.
Thank you, Martina. I don't know if there are any questions. I have one for you.
Mm-hmm.
I would like to know the situation in Germany now. Will there be a federal approach concerning the system to be put in place, or will it be depending on the Länder decision? So that's more the government structure.
Mm-hmm.
Yeah.
So right now it seems like there's a federal approach, but things are always changing. So 1 week it seems like path A is going to be developed and done, and the other week then. So there's a very rapid changes. So it's very hard to say some real something that is really going to happen, but the current situation is that there's going to be a federal decision, and the app is going to be developed by it's going to be developed and then spread on this federal level. So it's going to be the same for all of Germany and not depending on the different Länder.
Okay. Thank you, Martina. There is another question on the chat, so I don't know if you see it, but I can read it for all. It's coming from Australia. Hello, Graham. How are you managing the issues with iPhone not allowing background Bluetooth access for third-party apps?
Mm-hmm. Right now, the approach is to check for changes in the signal. So basically, you see when somebody is approaching and when somebody is leaving, because that is something that is allowed with iPhones, and also that this change you can basically use. There you get actually a signal, and also for iPhones, and also this allows them to get this change in the app without it having continuously running in the background. So this is the idea to use there. Then, of course, it would be great if we can use the Apple API that they will, I think, publish in mid of May. We are in contact with them and also have suggested the private set intersection as an improved privacy, and also that maybe we can introduce second order tracing there. So this would be, of course, the ideal solution.
Okay, I think that we're going to group the questions that cannot be answered right now and try to answer them later on. But we have to move to the next presentation now. We will move to Gary's presentation because Mr. Herbal is still in his meeting, so I hope that he will join us. He told us yesterday that it was a difficult day for him, that he will join us at the end. So can we give the presentation, the ball to yes, perfect.
Yeah, so good morning from Vienna, Austria. First of all, let me thank you very much, PSCE, for organizing this webinar, and I'm just coming to the point. And let me also say that I'm not a technician or an IT person, but I'm working with the Red Cross. I'm the federal commander, and I'm also engaged in all the crisis management stuff for the Republic of Austria. And I'm also a consultant to the Austrian government in this case. So I'm more dealing with the effect sides of this technology, not so much with the technology part. That's why I like to repeat what is contact tracing at all. I'm sure you know that. Contact tracing is the process of identifying persons who might be infected by other persons. Usually this is done by the authorities in a manual or semi-manual way, and in scaling, in very fast scaling situations, it might be an additional benefit to have some digital or technology-based contact tracing tools, and this is why we were designing the Stop Corona app that I'm presenting right now. You see that contact tracing means that in this green box that you can stop the chain of transmission if you are identifying those persons that are contact persons 1 or 2, and then isolate them or have them self-isolated anyhow. Let me just point out that the time, and you saw it with Martina as well, but in a different methodology. What you see here on the epsilon on the y axis is the viral load of a person, and you see that there is that if Bob is being infected on day 1, and then there is a beginning of the infectious period, so a threshold for the viral load that is, of course, not an absolute value, but it is relative to the biology of the patient, or the infected person. However, you are starting to be infectious before the symptoms are developing. This is one of the aspects of COVID-19, and the problem is that if you are waiting and with your information of all your contacts until you get a test result, and this may last for, I don't know, 1 or 2 days until you get a test result of your PCR test, then the contact persons themselves might be infectious themselves already, and infect also others, and this second order persons, as Martina called. So for us, this was very important to give users of an app the possibility to inform their contacts already when they are developing symptoms, when it's not clear whether they are infected with COVID or any other, or for any other reasons they are sick. So, but however, we found out that we need to have a two-tier system. That is, on the first-hand side, to issue a yellow warning or yellow information. I have symptoms, maybe I will be sick with COVID-19. So please, my contacts, isolate yourself as much as possible. And then if I get my test results back, I either send you a confirmation, a red warning, that yes, I am sick and please do keep your isolation, or I give you green information that my test results are negative and you can lose your situation right now. You can go amongst people again because it's not of COVID-19 my infection. So, and this time frame for contact tracing, to avoid that we need to have first, second, and maybe even third order persons, contact persons, it is of very high importance in our view to be as fast as possible with the information for the first contact persons of those people who are developing symptoms. And this is what also Professor Christoph Fraser from the Oxford University says, that if there is a digital technology like tracing apps, and they are rapidly and widely developed, and then they are very quick in informing those people, then this is paying back to reduce this R effective factor and slow down the rate of transmission, support countries to emerge from lockdown safely, or we can again gradually ease the restrictions the societies are suffering from. And the simulation they were running say that if there is a 60% coverage and a 60% compliance with the information the app gives you, there is an effect of around minus 0.2 in this basic reproduction rate. So if you have a lower spread amongst the smartphone users but a higher compliance, you can of course compensate. However, this is what the simulation said. And we have in Austria we are running simulations as well, of course, agent-based simulations, and they show very similar effects. And they show that if you start informing those contacts at the beginning of your symptoms, at the onset of your symptoms, then the effect might be even higher and may have a very big single impact on the epidemic situation. So what we did with the Stop Corona and why we did this, all this flatten the curve, slow down the spread. What we are doing is, like Martina described, we have digital handshakes. So we more or less we're exchanging something like an ID. It's not exactly an ID because it's anonymized. And then you get notification in the event of an illness so that you get more information, what to do and how to do. This was our timeline of 9th of March 2020. We started with a design workshop with ideation and conceptualization. So quite early, because we were at this time at a very steep phase in Austria with the epidemic curve. So we had a lot of new infections every day, and at that point of time we were making or having the decision to be as quick as possible with the digital solution, because we didn't know how far this curve will go up and how soon the authorities will be overwhelmed with manual contact tracing. In fact, at this 9th of March, they were already complaining for more than an hour, more than a week in the daily conferences that they can't stand the contact tracing load anymore. So we decided to be very quick. And we were very quick. So within 2 weeks, 25th of March, we were going live with the application that was launched in the Play stores. What we did there is we had a manual pairing only. So you needed to have a user trigger to pair your smartphones. We already did the reporting function for the corona infection and the notification in the event of an infection. With the first release then, afterwards, this was again approximately 2 weeks later, we also integrated the automatic pairing with the Bluetooth Low Energy protocol, with a Swiss module P2P kit, and had and implemented also this two-tier information system. So more or less the yellow, the red, and the green information. Also, we had implemented at that time a self-check of symptoms to be able to report it back to all your contacts. From the very beginning, by the way, we paid the big contribution to privacy issues. So it was made, the app was designed or was made with a privacy by design also the architecture by design. However, we had to have some to overcome some constraints and to be more weak in some points, because the technology was very rudimental at that point. Again, 2 weeks later, we open sourced our application, and will soon also open source all the background and the server applications we are running. And we were in very close contact to all the privacy and data protection NGOs in Austria, who assessed also before that date already the software and the application, because we needed to ensure that people are trusting these apps and that they don't have the feeling that someone or an authority or whoever is watching all their moves and all their contacts. Friday last week, 30th of April, we got the beta version of the Google Apple API to integrate it in our model. Just right now, until yesterday evening, we were busy with the assessment of the API, and this week or next week we will be starting to integrate this API that will be published by Google Apple at 15th of March, and around a week later or end of May, we will be ready to use the API also in the productive version of the app. However, this API will help us to perform the automatic handshake. It will help us to overcome the restriction of the iOS system with the Bluetooth availability when the app is running in the background. However, the API will not allow us to do manual handshakes, user-triggered handshakes. I will later explain you why we need this. So we will have a two systems app. First, we are using the Google Apple API for the automatic handshakes, and our solution, most probably again with Google Nearby, for the manual handshake. Yeah, the functionalities I already talked about. So we are recording contacts between mobile phones in a decentralized way, and then we are warning them, of course. We are using random IDs and a key pair consisting of a public and private key and hashtags, by the way. So this is everything stored on the devices, on the smartphones of the users. And with the Google API and Apple API, we are also rotate these private keys and public keys in a, I think, 10 or 15 minutes interval, so that even this linkage attack won't be possible anymore. This is how the user journey is looking like with the automatic handshake, and you see also here that you can start, even if you have activated the automatic handshake function, you can start a manual handshake. Why is that important? So the functional feedback we are getting and all the critics we are earning is that Bluetooth is not a very reliable source of information if you are having a possible infectious contact, because signal strengths are changing based on the situation, based on the handset you're using, how you're holding it, and all this. So on the other hand, there can be also very easily false positives. So if you are just divided by a curtain or by a wall, a thin one, you might have a positive contact. But however, so the manual handshake is also important. There are some use cases. So for example, if you're in a yoga class and your mobile phone, your smartphone is outside in the locker, but you're sharing for an hour a small room where you do yoga, and we know from our clusters in Austria that this is, of course, a source of infection. Then afterwards or before, you can start your manual handshake with all the other mates you have contact in this yoga class. Or if you're in a meeting, in a smaller meeting room, you share the same airspace for 2 hours. It might be that you are 4 meters away from someone, but still this is a contact that is likely to be infectious. So then that we try to establish a ritual Like when the first one of a meeting is leaving, we say, okay, let's interrupt now and give us the 30 seconds to start the manual handshakes and to inter-exchange our public keys here, that we trace each other as possible contacts. Because in this phase where we are now in the containment 2.0 phase, it is very important that we are very sensitive. So we are okay with many false positives, but we are not okay with false negatives, because each and every person we oversee in our contact tracing, in our containment strategy, can start again because they may be asymptomatic or apparent symptomatic figure, that they can start again this epidemic or this exponential dynamic in the epidemic. So this is how you do it when you are inactivating it. On the right-hand side, you see that this is your contact tool when you are doing the manual handshake. So you get a random 4-digit number, in this case 3643, and then you can say, okay, I'm 3643. Who are you? And the others say then, okay, I'm 4711. And they say, yeah, okay, I have you. I tick you. Then the boxes will appear, and I tick you there, and then I save you to my contact diary. So this is the assessment. So we are asking regularly, how are you feeling today? Do you feel fine or have symptoms? And you can report the symptoms. However, the possible results is that first you say, okay, you have symptoms, so you are sick, obviously, but there is no sign that you are sick with COVID-19, so please wash your hands regularly, keep the distance, and so on and so on. If you feel sick, however, stay at home. Or the second is that the symptoms you're describing can occur in case of a corona infection, so please report your suspected infections, and then you are doing, again, anonymously this notification. Then, of course, we are asking for some kind of ID. In our case, we're asking just for your mobile phone number. You can validate it with a PAN, and then you send. In this second, you're sending the information to all your contacts that are stored in your device. Again, with the public key, and only those devices with the private key that is fitting to this public key can dechiffrize the information on your display. Yeah, and then you get some report stations, I told you before, and what you get is, this is, for example, the orange information, then you get a push message, and then you got an information that one of your contacts is a suspicious corona-infected persons, so you should isolate themselves, and then you get a red alert or a green one, and the red would say that it is obvious, and the tests say that this person is coronavirus positive, so please stay isolated. And then you get the next information that you should contact the authorities. The same is true for those who are reporting the infection, that you should contact the authorities either by phone. So there's a health consultation line in Austria, 1450. You should call there, or you should go to your doctor, or call him better, not go, because then you're breaking the isolation. Or the third possibility is that you are directed to a portal where you can trigger electronically in the web. You can trigger your test, and then you get the next step. You get already the contact tracing tool from the authorities, where you start recapping the last 2 days, just to keep record of the contacts that you are aware of. Yeah, in terms of privacy and security, we have very critical privacy and data protection organizations in Austria. All of them together were making a code review. And they say that everything is more or less everything is fine. They gave us some hints to be better. We already implemented them, and then finally the source code was made publicly available at 24th of April, as I told you before. So the next steps will be that, as I told you, the integration of Google Apple Exposure Notification API within the next 2 or 4 weeks, depending on the technical on the final product that Google and Apple will launch 15th of May. And we, at the point now, we think that end of May, beginning of June, we will be ready with the integration of this Google Apple API and having the automatic handshake with Google Apple API and the manual handshake with our own solution that is based more or less on Google Nearby. And then what we are planning ahead is that because the smartphone penetration in Austria is 73% of the population, meaning that smartphones that are feasible to use the app. So the next thing is that we want to integrate Bluetooth beacons for people without smartphones. Of course, the business case or the use case will be different because there you can't do it anonymously. You need to, if you are purchasing or getting a Bluetooth a beacon, you need, of course, to save at least your contact details, your telephone number in a database, so that you are that we are able to send you SMS or to call you in case some of your contacts are reporting symptomatic infection. But however, this will be for the Bluetooth beacons integration. We are waiting for a standard, more or less, because this will need that we are purchasing hardware, and once they are not standard compatible then with a standard, this would be nonsense and producing just stranded costs.
Yeah, thank you, Gary, because we are running out of time, and I know that Peter has joined us.
Okay.
I don't know how far.
I'm at the end now. I'd just like to give you 2 take-home messages that are important for us. The first is that the report and the information of the contacts should be as fast as possible. In the best case is in the second when you are discovering your first symptoms that can fit to a COVID infection. So we need the yellow, the red, and the green information system. And the second home message for us is that we also need this manual handshake, the user-triggered handshake, to be sure and to be all in the edge. All the edge cases can be covered with this part. So thank you very much.
Okay, Gary. So maybe just a very, very quick question, and then we go to Peter. One question was related to the penetration of the use of the app in the population. So in Austria, what do you think about that? How are you preparing or communicating about the use of the app?
Austria has 8.8 million inhabitants, and our goal is to have 4 million users of the app in summer. We didn't campaign for it at all. There was just a political discussion about should it be mandatory to use the app or not. Now we are very clear politically that it should be a voluntarily application. But we didn't start campaigning right now. Right now we have 560,000 downloads and usage of the app. However, this is not enough because our goal is to reach 4 million users in summer.
Okay, thank you. There were also some other questions about EU interoperability, and I think that will really give the floor also to the European Commission, because Peter will also cover, of course, what we want to achieve is EU interoperability. So I will be switching now. Do you see the screen?
I don't see a screen.
Okay. Okay.
Should I try to upload it, or does it work?
No, I think it will work. Yeah, thanks, Peter. I will. Should be on. Is it okay now?
I see the slides, yes.
Yeah, okay, so I can start.
Can you see me?
Yes.
Or no? Okay. Good morning, and apologies for being late and that you had to change the order of the presentation. So now you saw the practical cases first before the legal framework. Okay, I start immediately. go to the next one?
Yeah, second one, yeah.
So as you probably have already heard and you know, because you're interested in this topic, there was a Commission recommendation on how technology and mobile data can support the exit strategy. That was adopted 1 month ago, and it sets up a common process for a common approach on 2 issues. One is the contact tracing apps. The other one is anonymized and aggregated data on mobility. Both measures have been used by member states, and in some member states you've heard the example about Austria about the tracing apps. Some member states have used the data to see whether the confinement measures have been respected. The contact tracing apps, the toolbox which was developed, I think that's on the next slide, sets out some requirements which are necessary for the functioning of these apps. This is privacy, this is security, these are epidemiological requirements, and a very important one is interoperability, so that they can be used when people travel cross-border. And we've heard from the example of Gary that of course Austria wants to have it functioning in the summer. I guess it's also because of the tourist season. So next slide, please. So these are the essential elements which are elaborated by member states and the Commission in the toolbox. So they must be compliant with EU data protection and privacy rules. Must be approved by public health authorities to avoid that there's confusion and that some kind of fraud or other apps are presented. They must be voluntary and only limited in time, so that they have to be deleted once the epidemic is over. I think there is consensus now that this should be proximity based and not tracking and no location data. So Bluetooth low energy seems to be the technology which is applied. It's anonymized data, based on anonymized data. The keys exchanged between the different applications and the devices are pseudonymized, but I think you heard that in Martina's presentation already. But what is important is that the identity of the other people is not disclosed to any other user. And interoperability is very important. Epidemiology I mentioned already, and then cybersecurity, because this is of course if these apps or the servers are hacked, that is would be an acceptance problem. Next slide, please. Then the importance of these apps, or the important role these apps can play, was also reflected in the joint roadmap by Council and Parliament, Council and Commission on the 15th of April, and it's one of the accompanying measures of the reopening and lifting of confinements to create a framework for contact tracing and warnings apps with the use of mobile apps which respect data privacy. And one of the statements is that confidence in these applications and the respect of privacy and data protection are paramount for the success and the effectiveness. Therefore, we think that what is essential is transparency about the whole process, the selection of the apps, the operators, and so on, and interoperability for cross-border use. Last slide. On privacy and data protection, there are several instruments which have been published. The recommendation sets already out some basic principles of privacy and data protection. They are more elaborate and reflected in the toolbox by member states and Commission. And then in parallel, there was Commission guidance on the privacy aspects of apps. This goes beyond contact tracing and warnings. apps. There's also about the self-diagnosis and also on the on information apps. But I think what is important for us is that they have to be voluntary and consent-based. The individual must be in control. They must be time limited. Data must be deleted. Proximity data reset, anonymization, and no identification of users. This is important to avoid stigmatization, encryption, to protect security and privacy, and also data minimization. The European Data Protection Board has also adopted guidelines on the 21st of April, I think, and they are more or less on the same line as the Commission guidance. Parliament has had a resolution. I think it's a topic which is very much in the debate. I think this can be a useful tool to lift restrictions and to reopen societies and economy. But of course, it's only one of several measures, and it needs to be supported by other measures. So I think the incentives for users to follow the advice or the warnings they get should of course be there in terms of that they, for instance, that they get possibility to get tested, that they get possibility to get compensation if they can't go to work, and so on. So I think this must be taken into account. This is not the panacea to solve all problems, but I think it can be a very helpful tool. Discussions are ongoing to fine-tune all this toolbox in the e-health network, which is the forum where these issues are discussed. And the key issue is at this stage is the interoperability issue. Thanks a lot.
Yeah, thanks, Peter, for this. I think that there are some questions. I see one, for example, related to privacy. Is there any kind of certification sample that will assert that the different apps are compliant with GDPR at European level?
No, I think this is a task of the data protection authorities in the member states and the authorities in charge of enforcement of the e-privacy directive or the laws transposing the e-privacy directive, because several of the provisions in this context are rather e-privacy provisions than GDPR provisions. But it's the national authorities which have to assess the gaps. Because in the first place, it's the data controllers which have to do that.
Yeah, and maybe another one, and then we will share the other question later on. But as a crisis could have a longer duration, are there not any issue about privacy and ethics that arise with accumulation of data and the duration of data on metadata as well?
So there's no metadata stored in the sense of telecommunications data, because there's no location data. There's no GPS tracking. That you can't track the movements of people with that technology. It's really only proximity with other people. The longer the crisis lasts, of course, the more data is there. But on the other hand, for instance, the data on the phones will be deleted after 2 weeks or whatever is the relevant period during which contamination is possible. So they will not be stored all the time. And under most of the systems which are being explored by member states, also the data on the back-end servers is deleted after a certain amount of time. And if it is kept, then it needs a legal basis, a kind of health law basis to empower or to allow the health authorities to retain that data for a longer period. But these laws, they are under strict proportionality requirements and normally also limited in time.
Okay, so thank you, Peter, for this. From what I heard also that we were just at the first iteration of the toolbox, so that will be also some evolving framework from the EU, and that we will adapt some of the document, or I mean, in the coming months. And you have a close cooperation with member states for this work.
Yes, the work is done basically by member states, and the Commission has a kind of secretariat function there. First iteration of the toolbox that has two meanings. On the first, there are several issues on which toolboxes are developed. So one is the contract tracing apps. The other one is the anonymous mobile data. But also on the contact tracing apps, there will be changes or amendments, and one will probably be rather soon on interoperability. So what are the interoperability standards in a non-technical sense, on which parameters apps in different member states have to be able to communicate with each other so that people can use their apps when they are abroad and get alerts when they are abroad. Other issues may concern, let's say, the calculation of what is the epidemiologically relevant distance and duration. I think the researchers get new knowledge every day or every week, and it must be possible to adapt this information in the functioning or in the algorithm of the apps. So there may be changes in that respect as well.
Okay. Well, thanks a lot for three speakers. Thanks a lot also for our participants, because I see that the chat has been very active. There are a lot of questions and also answer and interaction between our participants. I will just, before closing this first webinar, I would like to share again my screen. Just to show you the program of our next webinar, because we consider that during this difficult period, it is very important to debate about this topic, and also to propose different webinars and discussion. So we'll try to organize in the coming weeks 3 other webinars on different issues, and you will see some are not that far from this one, because we will also tackle ethics on social acceptance, the population, and first responder experience from the crisis. So we will keep you posted, and we'll do the follow-up of this webinar. I would like to thank you all for your participation today. Thank you, and goodbye, and take care. Bye-bye.